bringing together voices in child and youth healthcare. This is CAFC Presents.
CAFC would like to thank the following member organizations for their generous support of our knowledge translation activities: the IWK Health Centre, the Children's Health Foundation of London, McMaster Children's Hospital Foundation, the Children's Hospital of Eastern Ontario Research Institute, the Children's Hospital Foundation of Manitoba, the Montreal Children's Hospital Foundation, the Holland Bloorview Children's Rehabilitation Hospital Foundation, the Children's Hospital Foundation of Saskatchewan, and Trillium Health Partners. We would also like to thank the following Keystone and program partners for their ongoing contributions that support all of CAFC's programs and activities. If you have any questions or comments for our panelists, please type them into the question box at any time during the presentation. You can also share your thoughts and questions on Twitter by tagging @CAFCTweets and using the hashtag CAFCPresents. All of our webinars are recorded and can be found on the CAFC Knowledge Exchange Network. Use the CAN to share these recordings with your colleagues or register an account and post comments, links, or other resources that you think will be of interest. And be sure to sign up for the CAFC Presents weekly email newsletter to stay up to date with upcoming webinars and our recorded webinar archive.
All right, hello everyone, and welcome to today's episode of CAFC Presents. I'm Doug Maynard, the Associate Director at CAFC, the Canadian Association of Pediatric Health Centres. And I want to welcome everyone back after a brief hiatus that we had during the CAFC annual conference and the Child Bright Kids Brain Health Conferences, both great events, and it was a great opportunity to see and meet many of you in person that we see on these webinars week after week, but it was a great opportunity to see everyone in person and connect. Today we're picking up right where we left off before the conference, where we were talking about opportunities and challenges to using routinely collected data and other opportunities to make data-informed decisions in healthcare, et cetera, where we had Dr. Eric Benchamal from GEO join us. Today we're continuing that conversation about using data, but this time we're going to be talking about using social sector data to build bridge lessons learned from PolicyWise's Linkage and CYDL initiatives. And joining me today as my co-host, as she often does join me, is Dr. Gail Andrew from the Glen Rose Rehabilitation Hospital in Edmonton. Gail joins us on many of our webinars. She's also one of the co-chairs of the Canadian Network for Child and Youth Rehab's KT and Research Committee, and she's certainly been a well-known, well-respected voice in the children's rehabilitation community, and she's actually been working closely with PolicyWise, who is bringing our presentation today, for many years, and she's definitely was the one who suggested we bring them to our webinar program actually for years now, so it's a great opportunity that we get to finally have them on the CAFC Presents stage. So joining us from PolicyWise today, coming to us from Calgary, Alberta, we have Jason Lau, who is the Director of Data Operations at PolicyWise for Children and Families, and he is responsible for the operations of the Child and Youth Data Lab, which is the CYDL, and he was responsible for the secondary analysis to generate evidence, which is the SAGE part of today's presentation. And joining him is Hannah Lloyd-Jones, who is the Project Coordinator for SAGE, and Hannah is an advocate for sharing data with a background in management and international higher education. So without any further ado, it's my pleasure to hand the virtual podium over to Jason and Hannah.
Great. Well, thank you very much, Doug, and thank you to Gail as well, and Gail knows us pretty well. All right, awesome, it's great. Well, thank you very much for the opportunity. We're a relatively small organization here and I'm actually in Edmonton, although we do have a provincial scope. We do have an office in Edmonton as well as in Calgary. But it's a great opportunity for us to speak to a broader audience across Canada and tell everybody a little bit about what we do, and hopefully this really leads to more interest in collaboration or even just knowledge exchange in the near future. So I'll get started, and then I'll hand it over to Hannah when we get to the SAGE part. So I'll just get us started. So PolicyWise for Children and Families. So PolicyWise, we're in Alberta. We're relatively small. We're about 25 or maybe 25 to 30 people, and we basically have been around for about 14 or 15 years now. And we exist to support the generation and mobilization of knowledge in the social sectors. And for us, the social sectors really includes health, for example, right? And especially in terms of how health intersects with the other sectors as well. And we do this through several ways, and so we have some small research grants, and so we're not CIHR or anything, of course, but these are seed grants or trainee grants and such. We do quite a bit of evaluation work. So we have quite a bit of evaluation expertise where we work with either our regional health authority or our government ministries or other organizations in terms of evaluating programs, development of strategies, and work related to that. And so, for example, Gail has been very much involved with other projects, but more recently, we've been working with the government on a broad FASD data integration project. So I won't really talk about that much today. The other big thing that we do, and we've been doing for the last 10 years now, is more data-related initiatives, and we've really carved ourselves out a little niche in Alberta to work with data from a secondary perspective. And then when we say secondary, it probably don't have to tell this audience much, but what we really mean here is the use of existing data for new purposes, right? So, for example, when you use administrative data, government administrative data, or health administrative data for research purposes, that is considered a secondary use. And Hannah will talk a lot more about this in a little bit. And of course, the great benefit is, of course, extracting value where there is such a huge wealth of information, right? And whereas, of course, in a research study, you can design every element. In admin data, you don't, but you get such a breadth, such a huge population that you could potentially work with, and to triangulate the types of information that you want from a system or population level. Okay, and I'll get right into the Child and Youth Data Lab here, and which is the initiative that's been going on for about 10 years now. And basically, it was established in 2007, and it's very much a partnership between PolicyWise, a nonprofit, and several government ministries. And the government ministries are really the ones that serve children and families and people. And so, just so you know who they are, so actually wait, I won't go over the authority and all that stuff. So basically, in Alberta, the ministries involved are health, children's services, community and social services, education, advanced education, and justice and solicitor general. Okay, and so these cover then, post-secondary. It covers schools. It covers disability programs. It covers income support programs. It covers corrections. It covers court appearances, and it covers, of course, a wealth of health administrative data. So stuff like physician claims, hospital data, and stuff like that. And we've been able to work with the government very much in a partnership model to link that data at an individual level. Now, it is all linked anonymously so that we don't know who they are, but we are able to tell, say, one person that is flowing through all of these multitude of health and social services, if they have a particular, hip replacement and then, go to, or actually, I guess it wouldn't be huge overlap with the university population, but say, a disability program, a retraining program, stuff like that, we would be able to tell. And we do the analysis at a population level. So this data set covers over 2 million Albertans aged 0 to 30, okay, and that was just a restriction of the project, and really has over 20 different programs within these different ministries. So it's really quite a wealth of information. And so, of course, in Ontario, in Manitoba, in BC, there are population data linkage centers. So I'm talking about ISIS, Manitoba Center, as well as Pop Data BC. And there are population data linkage centers across the world as well. One of the things that makes us relatively unique is that we are sort of one of the earlier ones to really look at some of the social ministries, whereas most of the other population data centers have historically been very focused on health and have sort of more recently been looking into other types of data. This goes over a little bit about how the data is linked itself. I won't go over it in detail. This is probably one of the things that would be great if you have that technical interest. Let us know. We can go over it in more detail. But basically, this takes advantage of a genre of linkage methodology called privacy-preserving record linkage, where due to our existing privacy legislation for the various ministries and public bodies involved in the project, they didn't really want to release names and addresses, very understandably so, right? So this is a system that allows us to link the individuals across different programs without disclosure of names and addresses and direct identifiers beyond the borders of the ministry. So, for example, then what we receive here at PolicyWise, we do not have names and addresses and direct identifiers. Even stuff like postal code is translated into larger dissemination areas according to Statistic Canada methodologies. So again, I won't go over this too much, but I invite you very much to email us at the end of the slide set and let me know if you want a better explanation of this system. Here is just a brief overview of the programs that are within the Child and Youth Data Lab and the age groups that they really cover in terms of eligibility. And so, on the left-hand side, you see disability programs, again, advanced education, which is the university and other post-secondary type training, corrections, education, child intervention, all sorts of data are in there. And then at the very bottom, there's some backbone key indicators, we call them, that basically cross the entire population, such as gender, age, socioeconomic status, which is by geography, some measures of mobility, and we do have some measure of indigenous status. Okay, and again, I won't really get into indigenous status. That is a fairly complicated data element and indicator. But of course, email us if you want to learn more about that. And one of the key deliverables, really, and this does take many years. We have this. The work that we're doing now is on a longitudinal data set. So basically, from 2005 to 2011. So we have 6 fiscal years of data, and previous to that, we had an earlier project that had only 1 year worth of data. And in terms of extraction of data, negotiating different agreements, working with the privacy and legal professionals, it does take quite a bit of time because I think Alberta, like many governments with ministries, there are somewhat silos that are set up, and data is, of course, collected for its primary purpose, which is in many cases administration of the program, payment of people, that sort of stuff. And so extraction for this other secondary purpose, this research and somewhat basically business intelligence type of purpose and data linkage across and between these public bodies is not a straightforward process. But we've learned a lot over the last 10 years, and we're moving forward to doing more with the data as well as having a discussion about getting more data as well. So this program overlap matrix can be accessed on the website. So basically, this whole thing moves and shifts when you click different cells, just to tell you the overlap between the different programs. So, for example, how this one just shows the individuals in the ESL program. So, and this in itself has been a very powerful tool, just because many different program staff between different ministries have anecdotal evidence, hunches that their clients are going to different other programs and how people flow between different programs. But this is the tool that really tells them exactly how many, over different years and whatnot. This doesn't tell them the order, but we can tell them the order as well through different tools as well. So, for example, the order in which people receive services. Our data scientist has been working on a new methodology using clustering analysis to see sort of broad sets of similar people who flow through the system in similar manners, for example. And it really gives us an incredible perspective on how the government serves people, right? And how people get those services and in what order, how many, and that sort of stuff, okay? And again, I would definitely invite you to have a look at the matrix. It's interactive. You can select specific years. You could look into sort of future based on the first year, past based on last year, and all sorts of stuff that you can play with. These are just the next couple more examples of other tools that we have come up with to again, help the program staff in the government of Alberta. And so these are dashboards that are based on specific programs. So, for example, family support for children with disabilities, and income support recipients that are on the screen right now. Now, these are not live dashboards. These are dashboards based on those 6 years worth of data. So of course, it has to be really used for system level sort of intelligence and informing policy development and whatnot. Okay? And again, these are all publicly available as well. So again, the analysis that we can do now with these 6 years worth of data really tells us a lot about what government services and how government services are utilized in terms of overrepresented programs. So for example, are there certain programs that kind of go together, and then sometimes it's unfortunate, of course, but it does give you a gestalt of some of the sort of services that the government offers. We can tell stories about resilience and transition. So for example, people who may be in, say, disadvantaged socioeconomic status or other indicators and how they fare through the system. What are some of the success stories and what are characteristics of those success stories, for example? We can look at transition. So for example, a key fact of life for these programs is that many of them end at 18 and new programs start at 18. So that transition from quote unquote childhood programs to adult programs is also very important because again, some people fall through the cracks and we need to see that sort of stuff. Time trends, of course, time trends is just, in terms of changes over time, in terms of program utilization and whatnot. And this is actually interesting because you can't definitively say if a policy change has an impact on the population, but this would at least tell you whether or not any changes are at least observed, if not, 100% attributed to a particular policy change over time. So I'm just going to show you, just a couple of examples. So this is one of mental health service use within the post-secondary population. This is of great interest right now for the government of Alberta, right, recognizing the stresses and suicide rates, for example, within some of these post-secondary students. And so again, this is a very overall view, right? You're just talking about mental health service use. But of course, we can dig into ICD codes for those specific services, break them down, and look at individual characteristics. This is an example of disability supports and this is AISH clients. Sorry, and AISH in Alberta is assured income for the severely handicapped. So these are people who are, as the title suggests, fairly handicapped and do require quite a bit of support. And you see that, of course, they are accessing and getting those supports relative to the population, of course, the rest of the population. And again, one of the factors that come up in these discussions with the government or with other people in the community is that, many of these stories that we can tell from the data are somewhat sad, right? And of course, it is just an effect that, people who access government services are often in a position of need. But I think one of the things I want to draw your attention to here is that, there's half the post-secondary involvement, versus the rest of the population. But when you're looking at the severely handicapped, perhaps that's actually not so bad. We're talking about half. We're not talking about a tenth. We're not talking about a quarter. Now, this includes upgrading programs, so it's not all like university bachelors and masters and PhDs and stuff. But still, you see that these severely handicapped people are accessing services, and they are going back for either university or some kind of upgrading type program. So that there are positive stories in the data as well. So I won't go over this in detail. I want to make sure that we have time for Sage and for questions afterwards. But these are just an example of some of the reports that are available. And again, I invite you to have a look. Now, policy impact for the Child Youth Data Lab and for many data-related initiatives are difficult, because there often isn't that direct line of sight between how the data is turned into knowledge and how that knowledge is turned into, say, change and impact, right? And this is something that we acknowledge and are working on very actively with the government itself in terms of how we look at impact, how we track the impact. This is just one example, quite from a few years ago when the data that we did produce impacted one of the decisions that were made in terms of mental health supports for children and families. And of course, this is always great for us when we're actually referenced for that purpose. But again, for the most part, when we talk to our colleagues in the government, our data is used in terms of informing discussion, informing briefing notes, informing other reports, informing decisions and whatnot. But we acknowledge that we have to get much better at that type of impact assessment activity. So I'm going to pause here, and I'm going to hand it over to Hannah. Now, Doug, I don't know, do you want to do questions now, or do you want to save them all for the end?
Well, that's thanks, Jason. We don't have any questions right now, but that's just my chance to remind the audience, if you do have questions, do type them into the question box as you think of them, and then we'll present all of those at the end of the session after Hannah has a chance to speak.
Awesome. So we'll just move on.
Perfect. I'm just getting into place. So I'm going to talk about SAGE, which is Secondary Analysis to Generate Evidence. This is our collaborative secondary data use platform, and it is for research, service delivery, and administrative data. And our goal is to link these types of data to be able to answer more complex questions. So our SAGE module is very different from the model for CYDL. Sorry. So CYDL is project-based. We have a discrete data set for specific years, and we are the only people who are allowed to access and analyze that data, and that data will be destroyed after a retention period. In contrast, SAGE will have, or we do have, a sustained linked data set, and we'll have ongoing data transfers and updates, and policymakers and researchers are able to access and do their own analysis on that data. The data that we hold in SAGE is about human participants, and it's from a number of different areas. So they include health, education, social science, for example. At the moment, we hold research data. In the next few months, we hope to get hold of some community service data, which is exciting. And further in the future, we'll have some government administrative data, hopefully. Before I go into more detail, we are going to ask the audience some questions. And before I do so, I just want to remind you of some data definitions to help you with the first question. Research data, we are defining it as the recorded factual material commonly accepted in the scientific community as necessary to validate research findings. In contrast, as Jason has talked about, and I'm sure you probably know anyway, but just a reminder, administrative data is collected for administrative purposes such as the registration, transaction, and record keeping, for example, data collected by government ministries. And in the questions, we won't be talking about community service data, but here's a definition anyway, which is data collected for the purpose of delivering services, for example, data collected by food banks or emergency shelters. So we will go to the first question. So the first question, and I think Doug is doing some opening the poll as well, is, do you currently use secondary data in your research? And I know we have a very broad audience here, so this might not apply to some of you, but if you do research, do you use secondary data in that research?
All right, we'll look at the results. It looks like 43% have said yes, they use a combination of all of the above types of data.
Yeah.
Yeah, only 7% saying no, they don't use any secondary data in the research.
Great.
Wow, yeah, that's interesting, because we did a similar question in last year from, wait a minute, I need to resume the slideshow, don't I? 1 second. We did a similar poll in 2016 with a group of 82 researchers, and our answer was fairly different. So we had 70% who don't use secondary data and 30% who do, and that was a combination of different types of data, but the most common use was research data, which was 11%. So yeah, we're obviously talking to a very savvy secondary use group here.
and you guys can see our screen, right?
Yes, we can, yes.
Okay, so our second question is, if you collect data for research purposes, do you currently make it available for secondary use? And the answers are 1, yes, or 2, no. Nice and simple.
All right, so once again, just make your selection on the screen. I think one of the things we had talked about, and I'm not sure if you have this on a slide coming up, Hannah, but we talked about perhaps getting people, once they've put in their answer for this is to maybe even in the comment box or the question box, post a comment about why they do or don't. What are the barriers that prevent?
That's question 3, which is coming up, but people are welcome to put it in their answers in now as well.
All right, we'll just get them thinking about that now. So if you do say yes or no, why, and we'll get to that question in a second while we're waiting. Close this off, and it looks like we've got 60% saying no, they don't make it available, and 40% say yes.
Okay, that's interesting. We didn't actually ask this question in our survey, but we're hoping to ask it when we do the next iteration, so it'll be interesting to see the comparisons there once we've done that. So we will go to the third question, which is, I think, the most interesting question. If you do share data, please tell us why. And if you don't share data, please tell us why. So we'll give you a little bit more time for this one.
All right, so and we can certainly move on with the presentation while people are thinking about this and typing these answers, and it may take them a little bit to compile their answers. So if you want to move on, we can certainly come back to the responses.
Yeah, that sounds like a good idea. We'll come back to it at the end.
And I think I personally would be particularly interested if you do share data, is there something in particular in your organization or in your province or jurisdiction that allows you, that facilitates that sharing? Because I think that would be interesting to share with others if you do have something that makes it easier versus, the no is often obvious, a little more obvious, but if for those of you, it'd be interesting to know what enables you to do that.
Yeah. Okay, so I'll move on. I know Jason has touched on this already, so I will just skim over this, just talking about some of the benefits of secondary data use, and in particular because I'm going to be mentioning not-for-profit data collection. One of the key benefits of secondary data use for that group is that it reduces the burden on vulnerable communities and avoids duplication of primary collection amongst those vulnerable communities, who are sometimes hard to reach as well. And again here, when we're talking about kind of ethical issues of secondary data use, I just wanted to touch on the fact that when data collection is publicly funded, it is kind of an ethical way of making the most use out of that data that has been collected. As you probably know, the environment is changing at the moment, and funders and publishers do promote data sharing. So the tri-agencies, NSERC, CIHR, and SSHRC have an expectation that research data should normally be preserved in a publicly accessible, secure, and curated repository for discovery and reuse by others. And the publishers are also following this. For example, PLOS ONE and Springer Nature do say that if you publish with them, you should make the findings behind your the data underlying your findings available for people to make sure that what you're saying corresponds to the data that you've collected. Also, as you probably know, there are lots of repositories out there, and many of these are open repositories, which is great for some types of data. So, for example, Dryad or Dataverse or Figshare. And you can look up a registry of research data repositories on re3data.org, which is a very useful website. Our model isn't an open data model, because the data that we use is much more sensitive, and it's about people. So we have a facilitated access model, which we'll talk about in a bit more detail in a second. And again, we've touched on these issues before, but there are certain issues around using secondary data, one of which is the costs of cleaning data, making metadata, making data understandable and reusable. But the key issue with using secondary data is legal and ethical issues. So most privacy laws, and here I'm talking about FOIP, HIA, and PIPA, which are the privacy laws applicable in Alberta. So where you are, there'll probably be different. There'll be different laws. And also in the Tri-Council Policy Statement 2, it mentions the need to consent or re-consent to use or disclose information about a person. We also need to consider the potential harm for an individual, for example, if data is misinterpreted or misused, the risk of re-identification, and the risk of disclosure of sensitive information about a person. So using the facilitated access model, which we have in Sage, we try to address these legal and ethical issues by encouraging secondary use by design, collaboration, anonymization, and access control. So I'll go into a little bit more detail about those now. So with regard to secondary use by design, we encourage researchers and others who are collecting data to, when they begin, well, before they begin to collect that data, to think about how that data will or could be shared in the future, to make sure that their clients or participants do consent in the correct way before that data collection starts. Obviously, you can go back and reconsent after the end of a project or data collection, but it is more complex. So we want the data that comes into Sage and the clients and the participants who are represented in that data to have been informed about how that data will be used, and we check that before we allow the data to come into our repository. The other benefit of secondary use by design means that the costs of the secondary use of data can hopefully, in most cases, be covered by grants. So you can write that data management cost, the data deposit costs, the data cleaning costs, the metadata creation costs into your grant and have that covered by your funder, hopefully, in most cases. The second way that we try to address concerns about misinterpretation of data is by encouraging collaboration between the data producer and the secondary user. So we often put our secondary users in contact with the primary researchers to make sure that they have a clear understanding of the ways in which the data was collected originally. And again, by having clear documentation and metadata standards, that can also make sure that the data is understandable and reusable for the secondary user. When somebody applies to access the data that we hold in Sage, we include the data producer in that review process to make sure that they understand the research proposals that the secondary user is proposing. And sometimes we have an external reviewer in that process as well. In terms of anonymization of data, to address concerns about re-identification of data, we have various techniques that we can use, and it will depend on the data set and how sensitive the data is. So we can limit the upper and lower ranges, we can reduce the precision of variables, we can suppress data, or we can use extreme methods, for example, dummy data sets. And the fourth way in which we try to ensure that the legal and ethical rights of our participants and clients are respected is having the access control. So we have a data access agreement with the secondary data user, which means that data user is limited to the proposed research. And one of the clauses in that agreement is there should be no attempts to establish the identity of individuals in that data set. Data access our data through our analytic environment, and this is a very secure environment with no internet access, and we have two-factor authentication as well to make sure that only the authorized users get into that data set. In addition, the only data that's allowed to leave that environment is our results output, which is aggregated results of the data, and we vet that data. So if they're small cell sizes, we'll suppress them. We'll just make sure that there is no identifiable information in the data that actually leaves our analytic environment. So I want to talk a little bit about our work with not-for-profit organisations. So as well as working with researchers and research data, we currently have a project called Calgary Thrives, and this is with 6 not-for-profits in the Calgary area. And I will talk a little bit about what we've learned from working with these not-for-profits and other not-for-profits, as well as researchers. With this project, the idea is basically to see what the barriers are to sharing data between these not-for-profits, as well as hopefully coming up with a poverty indicator using the data that they can share. So that's an ongoing project, and it's very exciting. So to talk about the lessons learned so far. Cultural change is slow, and I think that is true both in the academic world and the not-for-profit world. There are lots of people who want to share data, but there is a risk aversity, and I think that That will change, but it will probably take a while to change. The other issue in both the research and not-for-profit worlds is the fact that making data useful is expensive. So it needs to be planned for, and it needs to be budgeted for in advance. Which kind of brings me on to my third point, which is in practical terms, you do need to think about this at a very early stage before you start data collecting. As I mentioned, you can go back and get reconsent, but it is much more complex and resource intensive. So going on to lessons learned, specifically for the not-for-profit area, there is a big need for capacity building in this area. Different not-for-profits have very different levels of data maturity, and that includes capacity, governance, resource, and expertise. And before I think anything is invested in this area, again, bringing it back to cultural change, there's a need to start to value data more. And again, this will vary across different not-for-profits. Some do see the value of data, but to see the value of data and invest in it, I think, is a need. And again, not-for-profits are very different, and they serve very different communities, and they have very specific and diverse needs. So offering them advice will be very specific to their situation. Unlike with research data, not-for-profit data often falls into a gap of privacy legislation and ethical oversight. So we talked about HIA and PIPA and FOIP earlier. Some not-for-profit data will not fall under any of these categories, which in some ways means that there's an opportunity to be able to create best practice in this area, but in other ways means that not-for-profits are often very risk-averse. And that's not only because of the unclear legal situation, it is also because their immediate priority is to meet the needs of their communities rather than look at the long-term benefits of sharing data, and protect the vulnerable populations that they work with, which can include Indigenous communities who also have complex data needs. I'm going to talk a little bit now about the approaches that we've taken in SAGE to try and encourage data sharing in an ethical and legal manner. So our first approach is that we feel that risk should be managed rather than eliminated and weighed against the potential benefits of data sharing. There will always be some element of risk in sharing data, but we want, if the benefit is worth it, we feel that that risk is worth taking, worth looking very carefully at the legal and ethical issues around that data. So, for example, we have wording that we work with researchers and not-for-profits with around consent to make sure that their clients and participants are informed in the correct way. We have template data deposit agreements and data access agreements for not-for-profits and researchers, and we have a clear data governance process. As we've talked about, a clear access process, and making sure that data is de-identified and that the data is stored securely. Our second key area is in the area of capacity building, and often when we're working with academic communities, they will have resources that they can draw on within their institutions, and we're not looking to replicate that. We're looking to work with institutions and partner up with them to offer advice about data management and data sharing. Where this is a newer area is in the not-for-profit area, and that's where we're hoping, working with a very small group of not-for-profits to start with, to develop some clear advice, expertise and tools in this area. We have got a really good paper by one of our postdocs about data sharing for not-for-profits on our website, and I can send out the link to that at the end, which is a new and interesting area. It's a very good read. Our third approach is to build trust with the people that we work with. So we want to establish relationships of trust with researchers and not-for-profits, and we want to ensure that they are the ones who are in control of the data, that they're faithful to their participants or clients, and they are involved with how their data is used eventually. And again, this level of involvement will depend on the data producers. Some people have more time to review data access requests, for example, and some people want to take a bit of a back seat in this. But we work with researchers and not-for-profits to make sure that they have the correct level of involvement for them. Our fourth approach is to share and develop relevant best practice in the areas of data sharing and work with selected partners to move practices forward. So form communities of practice and make sure that we're pushing the envelope forward where we can. And as we've mentioned this before, I think one of the most important aspects of SAGE is to encourage collaborations. So our goal is to help build collaborations between networks of researchers, community organizations, evaluators, and encourage, excuse me, sorry, that networking, which we think will encourage the sharing of data in a richer way, basically, rather than just sharing data with unknown people, making sure that these people have relationships between each other and understand the data that they are using. So to conclude, I just wanted to bring government data, government administrative data, back into the picture. As we know, the government has a very different philosophy and perspective and role in society from not-for-profits, but they often have the same goals, which is to improve lives through social service support, and they serve the same populations, often vulnerable populations. And data is the point of convergence and collaboration for these two different groups. Our vision with SAGE is, so going back to our CYDL matrix, is to, in the future, be able to have a matrix similar to this, which shows the programs which people use in not-for-profits and in government, and be able to compare and analyze that data along with research data as well. And we think that this could have a massive impact and improve services and programs for vulnerable people in Alberta. So that is the end of our presentation. So we would love to hear your responses about why you share or do not share data and any questions that you might have.
All right, so we'll go to those answers right now. We'll give Dr. Andrew just a couple seconds to sort of formulate some thoughts and questions and maybe share some of her experiences in working with PolicyWise. In response to the questions, it was largely nobody said yes they do share data and gave any reasons why. It was largely people identifying issues around privacy as the main reason why. And I wonder, and we often hear that. CAPC has a data sharing program, the Canadian Pediatric Decision Support Network, and we often hear lots of issues around privacy being the main barrier, even when it's aggregate data, even when it's properly anonymized data, even when it's not individual patient identifiable, etc. It's still often is privacy, quote unquote, is named as the reason that there's not more sharing. I was wondering if you had any thoughts on that.
I mean, and it is definitely something very key to all of our data initiatives, right? And I assume you, in the context that you spoke about, is probably more about like health system data in terms of like health administrative data.
In many cases it is, but not always, right? We often we hear the issue of privacy is the reason we don't share from all sorts of different data sets. Whether that's so, or not, like there's often a perception that they're not allowed to because of privacy reasons, when it's often not the case.
Yeah, I think first of all, I think that really the big lesson from what we've dealt with in terms of privacy concerns is that it is about interpretation of the privacy law, and because the privacy law, you know, in all provinces really, like they're all principle based. They rarely have like black and white, right? And so it really depends a lot on how each lawyer, each privacy professional ends up interpreting and translating that into operational decisions, right? Now, I mean, it can't be ignored, of course, right? And so when you're talking about, say, government data or the administrative data, anything that falls under, say, your equivalent of FOIP, obviously, you know, talking to the experts is necessary, and sometimes interaction with your Office of the Information and Privacy Commissioner may also be warranted. I mean, for us here, we've been fortunate because, we've had a great relationship with our OIPC. They're very approachable and very open to helping. And I don't know what it's like over there, but certainly I think those relationships are really important, like both the relationships with your commissioner's office as well as relationships with your privacy officers in the different stakeholder organizations that you want to work with, right? Now, so there are no shortcuts. It really is sometimes about talking to those people, making sure that they understand the risks and they understand what you did about the risks, right? The mitigation factors, and I think that is really the key because they all understand that it's not about the elimination of risk, but it's about the management and mitigation of risk. And that is a core principle of privacy law in general and what they, the messaging that we get from them. So I think that's really where it is. It's about the conversation. Now, in terms of research data, it is a bit different because, of course, research data doesn't necessarily fall within the privacy legislation purview. So even in Alberta, for example, and again, I can only speak to Alberta, within the FOIP legislation, so the universities fall under FOIP, but research data is specifically excluded, in one of the clauses. And so for that, it really falls under institutional rules, which honestly, most of the institutions just say, hey, go follow, Tri-Council policy, right? So it's really just depending on how you comply with that. And that's one of the things that we try to work with our research community is to plan ahead, Don't have a consent that says only Dr. Bob will ever see this data because what if Dr. Bob dies in the middle of a 10-year study, right? Like, God forbid, of course, but I mean, it's really important that within the context of consents, that we are future-looking, in that. And again, that's a conversation with the ethics boards, right, in terms of what still is protecting the interests of the participant. But again, the principle applies that, there's a balance between protection of privacy and benefit to the whole, right? And again, what Hannah has said before, the balance between risks and benefits and not the elimination of risk.
All right, thank you. That was a great answer. Really, especially about talking about, really focusing on the mitigation and demonstrating to people that you've done what you can to mitigate privacy risks and issues. Certainly doesn't solve all the issues, but that was a great answer. Maybe we'll go to Dr. Andrew. Gail, your thoughts as a clinician who's, in the rehab sector, who's worked with this data. Maybe you could just share some of your thoughts.
Well, I really found this data very, very helpful. I'm the medical director of the FASD, Fialco Spectrum Disorder Clinical Services here at the Glenrose Rehabilitation Hospital in Edmonton. And I often jokingly say that what the data tells me is what I have intuitively gleaned just through years of clinical practice. But now I actually have data to support what points to the next step of what do we need to do for FASD in terms of better supports and services, interventions, and ultimately prevention. So I'll just give you a couple of examples. What the data has, we know that there's a high rate of mental health in the FASD population, but I didn't realize compared to other Albertans, 74% of individuals with FASD have a mental health condition versus 14% of other Albertans. Another example is high healthcare costs. 64% of individuals with FASD have higher healthcare costs compared to 17% of other Albertans. So huge discrepancies, which stimulates the research question, why? And how can we provide better intervention services and supports and look at more aspects of prevention? So that's why I get really excited about this data, that we now have drivers for future research, as well as drivers for changes in policy, making, perhaps, for example, making access to mental health services that are FASD informed or trauma informed. We need to increase access to that sort of service. So we can advocate for that change. Another great way that we are using the data in Alberta are fetal alcohol spectrum disorder clinical services are under the auspices of Alberta Government Cross-Ministry Committee, where all these same ministries that contribute to the data actually sit at a common table and look at decisions about aspects of diagnosis, assessment, supports and services, training, education, and prevention for the whole of the province using 12 different service networks. So this data will inform our next 10-year strategic plan of going forward. So there's so many uses of the data. There's another project going on across Canada through the Canada FASD Research Network, where we have a data set that's being collected across from all diagnostic clinics, and that data will go into the SAGE repository, so that rich data from all across Canada can be used for secondary analysis, or perhaps answer some questions such as what interventions make a positive outcome. So I see just endless use of what this rich data set can do. So hopefully the other clinicians in the audience are as excited as I am.
All right, and Jason, feel free to jump in with any comments at any time. We certainly love to have a good discussion about this. We did have a question come in from Shannon, who's asking, does the CYDL and or SAGE have the capability to link data within their databases with other data held by external stewards, for example, other ministries that are not already captured in these data systems? Or does the de-identification process make this not possible?
You know, we've been thinking about that actually, because we've been talking to the government about adding more programs from different ministries, for example, right? And on a technical level, it really, you know, shouldn't be an issue. It's just a matter of, again, this gets into some of the details around how we process some of those identifiers. So basically, very briefly, each ministry or each public body, I guess, actually anonymizes the de-identified data, or sorry, the direct identifiers like names and addresses in a very specific manner, using a very specific algorithm that basically produces a one-way hash of those identifying information, so that it cannot be back computed, right? And we then, or not we, but the host, the hub software that is able to take all of those hashed identifiers and link them. So theoretically, you know, as long as we use the same salts and the same algorithm and the same parameters to create a new set of hashed identifiers, it really shouldn't be a problem. But again, like, I mean, I think everything in practice is always a little bit more complicated, and we have not made that attempt yet. Part of the reason is that the software that was used for CYDL was a fairly black box type of software from IBM. And we've developed our own in-house version that uses more sort of openly available algorithms and whatnot, and we just haven't had a chance to actually apply it to that situation.
All right. We have about just a couple minutes left. We did have one more question here, but if somebody has another burning question, I'm sure we will have time to answer at least one and maybe two more questions. But the question is around, are you aware of any other provinces that have this type of interministerial collaboration around data? I know we're familiar here at CAPC with the program in Manitoba, and I'm not sure how similar it is. We had Marnie Brownell come and present on their program for sharing data, and it seems similar, at least in the sense that it's interministerial collaboration between health, education, justice, social services, et cetera, and they're doing some similar sort of data analysis across those different sectors. I'm not sure if you're familiar with that program and how similar that is to yours, but are you aware of other provinces that have this similar kind of collaboration at this level?
So we're fairly similar to the Manitoba program. That was definitely one of the models we followed because they've been in existence for quite a bit longer. You know, around the world, again, we're aware of the population data linkage centers around the world, but you know, to my understanding, most of them are quite a bit more biased towards health. But many are starting now to include sort of other types of social type data.
All right. Well, it's certainly an opportunity for folks to get in touch with you and the folks from Manitoba. If you're from another province and want this access to this type of data, I mean, we've got some great examples here who have taken people who have taken a real leadership role in this. Because as Dr. Andrew described, I mean, there's so much opportunity to improve service in the interest of holistically in the interest of patients and families by using this data across sectors. Gail, do you have any other comments or questions?
Well, I think it's moving beyond the health. That was really informed a lot for me. We now have the education data. I now have a sampling of who is in the child intervention, the child welfare system, and looking at access to post-secondary education. I think that's a very positive thing with fetal alcohol spectrum disorder, that there are some individuals with FASD who are going on to post-secondary. And one of my questions is that who is that population that's going on to post-secondary? What are the factors that have supported that individual to be able to have a very positive outcome? Because we always hear about the negative stories. Let's talk about the positives. So I think this data is helping us as both clinicians, researchers, and also people who are trying to put in interventions and supports and services, make a difference.
All right. And I think with that, we didn't have any other questions come in, so I think we'll wrap it up here, and maybe we'll pass it back to Jason and or Hannah, or both. If you have any final closing comments, any sort of key messages you'd like to leave the audience with before we sign off.
Nothing much really. It's again, thank you Doug and Gail for the opportunity to reach a broader audience across Canada. And again, definitely feel free to get in touch with us in terms of just if there's an opportunity to share or collaborate about what we've learned, that's not a problem at all.
All right, sounds good. All right, so with that, I guess we will wrap this up. We do our webinars every Wednesday at 11 a.m. Eastern Time, and it's always great when you can watch live, as it is your opportunity to ask your questions and really drive the discussion. But when you can't watch live, we do always record these sessions and make them available after the fact on the CAPC Knowledge Exchange Network at can.capc.org. Next week, coming up, we're back on with our regular full schedule coming up until Christmas. So next week on November 22nd, we're going to be once again hearing from Dr. Christine Weckerly and Elizabeth Saw from the CIHR team in advancing boys and adolescent mental health. And we're going to be talking about what we know about sexually exploited adolescent boys and the health impacts on that population. And then following that, on November 29th, we're going to be welcoming Dr. Jeremy Friedman to talk about how Sick Kids has implemented some of the recommendations that are coming out of the Choosing Wisely initiative, sort of identifying unnecessary medical procedures, diagnostic procedures and testing, et cetera, and other unnecessary medical processes that are commonly prescribed or initiated, and talking about how Sick Kids has used some of that information from that program to reduce some of these unnecessary programs. So some great stuff coming up in the next couple of weeks, and we look forward to seeing everyone back here soon. Thanks again. Bye, everyone.
Bye.
Thanks.
Thanks, Doug.